Hello, you. Yes, you. This is Usayome Sale from Ways Primetime. Now, we appreciate your continued support for watching our content, following us across all our social media. But we've noticed, for those of you watching us on YouTube, 88.5% of you who watch our content aren't subscribed to our channel. Why? Now, if you are enjoying our content, you enjoy our shows, and you want to stay updated on all things Ways, it's time to hit that subscribe button below. Now, subscribing isn't just for you. It's for the growth of our channel. It helps us get bigger and better. With your support, we can continue to bring even more intriguing and exciting content. How about you subscribing right now and being a part of our community?
Morning and welcome to Ways Breakfast, hashtag what are you saying? The ultimate breakfast show for young and vibrant minds. This is to tell you why you should kickstart your mornings with us as we dive into thought-provoking conversations on politics and national interests, trending issues and social commentary, physical, mental and total wellness, tech trends and innovations, financial literacy, and of course, youth empowerment. You can tune in every Monday morning to Friday for fresh perspectives, engaging discussions, and inspiring stories. Remember, you're the main ingredient in this conversation. Well, I am Okikiola Taiwo Jalukon, and I welcome you to the show, especially as your host. And you know, I'm never here alone. My babies are here. So I'm saying good morning, Gazviti. Good morning, Alichi. Good morning, girls.
Who are your babies?
Good morning, Okiki.
I'm
your baby.
I'm
your baby.
I'm not your baby.
I'm your baby.
You that I can born 5 of you.
Hey,
if I did what my mates were doing.
From where to where?
Have you heard something like that before?
Of course.
Your mates doing.
Of course.
I mean, people that like to form seniority, I can born you if I was doing what my mates were doing. And if you check the age difference, there's nothing significant.
Cut the bullshit, bro.
Okay, so this conversation actually made me bring something popped up in my head. What is your people's viewpoint on respect?
On respect.
Reciprocal. Period.
What about you, Oluchi?
I just say respect regardless, whether or not you get same back. And reciprocal is good, but there are some times that you should, what's that word? Be the bigger person in many situations. So even though the person has constantly shown you disrespect, you shouldn't always also take the disrespectful stance. You can still be respectful in your way while still being in your lane. So there's a way it can blend, I guess.
If I'm going to talk about how Yoruba people used to respect people, it's on the high level. But when we want to insult, it's also
on another
respectfully.
level.
Excuse me, sir. It's like
You're not okay, sir.
Especially
in a very sarcastic manner, and I love it so much.
If it's a busting, and I say that because sometimes I see elderly people, maybe when we're commuting to work, they tend to use those words like, I have somebody like you at home, I do this, but they will rain certain insults that no one should ever even take, both old or young. And they will not bring it to say that, do you really want to be the bigger person in that case? Or you want to say, you know when they say back to send that thing? Yes, and you want to send it back. So respect sometimes it's almost like it's common to respect anybody, but it's also a very hard thing to do. Just like they say common sense is not common. So
Come on.
I hope that in all situations I can be respectful. Because
I like that.
some things get to me, and I'm sorry. Anyways, this is your chance to follow us on all our social media platforms showing on the screen. As always, Wednesdays are meant for conversations around wellness and all there is to know. And today counts as one of those days. But first, as I said, please subscribe to our YouTube channel at Official Upgrade TV. Like and share this link. Today, we're tackling a critical issue that is affecting millions of lives in Nigeria, and that is the alarming high maternal and newborn mortality rates. We'll have an expert guest join us later in the show, but for now, let's go on a break, and we'll start off with today's topic right after the headlines across the globe. Please. Welcome back to the show. So because of how important this topic is, we'll be moving our headlines across the globe for later. So yes, saying welcome back to the show again. As mentioned earlier, we're going to be looking at what's behind Nigeria's alarming rise in maternal and newborn deaths. Nigeria's maternal and newborn mortality rates are alarmingly high, with the country accounting for 10% of global maternal deaths, despite representing only 2.4% of the world's population. Several factors have been highlighted that contribute to this trend, from inadequate healthcare infrastructure. Poor access to healthcare facilities, especially in rural areas, is a significant concern. Many primary health centers lack essential equipment, clean water, and trained birth attendants. We also have low facility-based deliveries. Only 43% of women give birth in healthcare facilities, increasing the risk of complications and maternal deaths. We also have insufficient skilled healthcare workers. Nigeria has faced or is facing a severe shortage of skilled healthcare professionals, with a doctor to population ratio of 2.9 per 10,000 people, far below the World Health Organization's recommended 17 per 10,000 people. We also have poor access to family planning resources, from limited availability of family planning commodities in healthcare facilities, and this contributes to the unmet needs for reproductive health services. We have malnutrition and related health issues, accounting for 30% of children under 5 suffering from stunting, and 27% who are underweight, exacerbating health vulnerabilities. We have socio-economic factors, from poverty to lack of education, and cultural practices such as child marriage and female genital mutilation also play a role in high mortality rates. Right about now, we will explore the potential solutions of all these problems, including the increased health care funding, how we can also strengthen health system and promote inclusive and equitable health care. Well, joining us this morning is Dr. Mrs. Ime Okong. She's a medical director and CEO of Ibeju General Hospital Public Health. She's a public health physician and the president-elect of Medical Women's Association of Nigeria, Lagos State. Do we have doctor here?
I'm here. Good morning. How are you?
Good morning, Ma. Thank you so much for joining us, doctor. So let us dive into this crucial conversation and examine the ways we can work together to improve health outcomes for Nigerian women and children. So my first question to you is, what are your thoughts on the current state of healthcare infrastructure in Nigeria, particularly in rural areas where it's most affected?
Okay, good morning, and thank you for having me. And I joined your conversation from the beginning, so please show me some respect. If not, you will collect.
Interesting.
That was on a light note. So, yeah. So, talking about healthcare services, especially in the rural areas, all of us know that the healthcare services is not equitably distributed, especially when you're considering urban-rural distribution. So we have a lot of factors that are responsible for this, especially when it comes to the resources, the manpower. How many people want to work in the rural area? How many people are well motivated to work in the rural area? Just like the people in the rural area are having issues with having the basic social amenities, the healthcare workers are not immune to that too. So nobody wants to go to an area where they have poor water supply, they don't have electricity and all that. So in a case where you cannot have healthcare workers available to serve these people in these areas, that is one of the very major reasons why we have inequitable distribution in healthcare services in these areas. Then the people that are in this area, many of them are of low socioeconomic status. Many of them do not have the level of education and awareness to education is one, level of education is one, then awareness How aware are they that you're supposed to register for antenatal, for instance, immediately you get pregnant, and that you're supposed to have a minimum of 4 antenatal care visits before your delivery. Many of the kind of deliveries we see are what we describe as head on perineum. See the head of the baby, see the head of the baby delivered inside the vehicle on the way to the clinic. That is if they even get to the clinic. I'm sure we saw on social media recently a pathetic case of a maternal death. I mean, how long can we continue like this? People want to ask some critical questions like 9 months is a long time for us to plan adequately for the delivery, safe delivery of this woman so that we can have a healthy mother and a healthy child. What happened? How did it become all of a sudden emergency? Because if you go for antenatal early, your history is well known to the healthcare workers and they plan effectively for your delivery. We shouldn't be having cases that you are rushing at the last minute and you're being even rejected. I mean, we shouldn't be recording that kind of things in this day and age. So these are the kind of things that we see in the rural settings.
All right, thank you
I
so
hope
much.
I'm being heard.
Yes.
Yeah, absolutely. Thank you very much. And you've mentioned, I think during your conversation, you did highlight how that misinformation is usually a major issue because if I'm not even aware of the number of times they ought to visit. So I think probably is as a result of cultural barriers because if you're referring to people in the rural areas, they just feel like my mother gave it to me without having to go through all these protocols. I can do same for my children. And so I want to ask you now, what do you think can help us combat these cultural barriers that people in the rural areas have so that at least we can know that, maternal death can be mitigated because it's not caused by misinformation? How do you think we can battle that?
Okay, so while for the techie people, you have social media awareness and like this that we're trying to do. But I'm just imagining people in the rural areas, how many of them have electricity to even power their phones or their gadgets to be able to listen to this? So we do what we call sensitization through their gatekeepers. Gatekeepers are the people they respect, people they listen to, traditional leaders, religious. You need to know how people believe so much in their daddy Gio, their imam. If he tells you this is what you're going to do, and that is exactly what they do. So we try to do advocacy to these people and give them the right information so that in the right places, they too can pass the right information to these people and let them know that if for one reason your height is not adequate for your that is giving you pelvic inappropriate pelvis for you to have a normal vaginal delivery, if they ask you to go for cesarean section, or if you've had like 2 or 3 cesarean sections and they're telling you to come for another one, that is not the time to say, oh, Hebrew women were loved by God and they listened to God. And it's this same God that has given knowledge to these people that have nurtured you so well and realized that this is the best mode of delivery for you. So this is not the time to go and try. Then at the end of the day, when the baby's fetal heart rate, fetus is not heard anymore, that's when they will now say, oh yeah, rush and go to this general hospital or go to this PHC when it is too late for you to have good outcomes. The most recent, our NDHS, our Demographic and Health Survey of 2024 gives us the data that out of that we have a neonatal mortality rate of about 41, which is an estimate of that when we have newborns, that is even if they are delivered live, because we have a lot of cases that the babies are even dead. We have stillbirths and all that. But for every 1,000 live births, we are having deaths of like up to 41, meaning that if you have 25 babies that are born, at least one of them would have died before they clock 28 days, which is the neonatal period. Before they are 1 month, they have gone back to their creator. It shouldn't be like this. A woman shouldn't suffer for 9 months and have nothing to show for it, or something that does not stay with her for long that she'll be proud of. Like we say, we should reap the fruits of our labor. So a woman shouldn't suffer in vain. If we plan adequately, inform them adequately, especially, like I said, through their gatekeepers. If we have opportunity of going into the community to sensitize them to, we try. But like I said, they have these people that they respect and they talk to. And, you know, we still have a very high level of people, well-educated people that still patronize traditional birth attendants. I can tell you for free, Lagos State has invested a whole lot in training these people because we have spoken a lot and we see that our people still go there. So what do we do? Okay, let us make this place safer for you and let us let them know their limits.
All right, thank you so much, Doctor. I mean, all the things you've said are quite insightful, I wouldn't lie. So let's talk a bit about the fact that I like the point Oluchi gave about the cultural barriers and all of that. But I feel like when it comes to this whole maternal thing, I feel in as much as there's a percentage of, you know, women that still go for this traditional stuff, just like you made mention of, I feel like there's still issues with the medical system in Nigeria. Like when you come to, you know, there's this video that, you know, that trended about last month or 2 months ago that Aproko doctor literally posted, everybody saw it. You can see how a particular, local community has, the forceps and all the instruments that they use in, you know, surgeries and all of that, they just have one each. Their bedroom is nothing to write home about. The maternity ward is nothing to write home. Like there's really like a lot going on, and which is why I want to ask, what exactly do you think the government have done so far, right? Because again, it just feels like there's really no impact from the government, because every quarter of the year, there's different budget that is drawn out for the medical team and all of that. But at the end of the day, we don't see anything going on. At the end of the day, you still see this death in rise and all. So again, in as much as I get her point of the whole cultural whatever, I still feel like there's a very big problem that is yet to be solved from the government angle, maybe from private individuals and all of that. We're talking about funding, we're talking about inadequate resources that these medical facilities they would need to ensure that anybody that comes to the hospital that is sick and all can be taken care of. So again, let's come back to the solutions. Let's talk about how the government can help, how we individuals can even help ourselves. Because again, when you hear a particular nurse and a government parastatal tell you that they need to pay me well, there's that tendency of the person being like lackadaisical about, the job. The person would want to be reluctant about, doing anything because, again, you know how it is here in Nigeria that most of us is money that is always motivating, is a motivating factor. For us to work, we have to see the money first. I don't know if you get what I'm saying. So I feel like we should talk about, how to tackle all of these things on the government angle. We as individuals, what exactly do we do to start curbing all of these issues? Are you with us,
Sorry, I was just... Yeah, I was disconnected a while. One of those challenges of working in the hard-to-reach areas with internet. So please, if you would say that again, I would be able to catch up with what you asked. I meant you talking about government and all that, but I didn't quite get it, please.
Okay. So, in a nutshell, what I'm just trying to say is, what do you think the government can do, can help, right? Because we've talked about funding and a whole lot of that. At the end of the day, we see budgets are being drawn, but we don't know what exactly happens to the money. Do you understand what I'm saying? Every now and then, you hear hospitals, clinics complain about inadequate facilities, the fact that many things, maybe probably medicines and all of that they would need to ensure that people that come into the hospital for them to be well are probably taken care of. I don't know if you understand what I'm saying. So, in as much as I get Oluchi's point from the whole cultural barriers and all, I think we should also talk about what the government can do, what they have been doing, and why it has not been working. Let's face that. Let's talk about it. Are you with us?
Okay. Yes.
All right.
So thank you very much for this. So we have individual variations. We have different variations in different state governments because that one cap fits all doesn't work like that.
Right.
You have some that are providing adequately without calling out particular states or particular regions. I can speak for the system that I work with, and I know that the Lagos state government is trying a whole lot in the area of trying to provide, because as a public health practitioner, actually, I've traveled far and wide, even during my training, and I've worked in some places where it's even difficult to find a doctor in some PHCs, even nurses in some PHCs. The head of the team is maybe the community health extension worker that we're supposed to use for task shifting, not the major role. So in the case where the backup, so to say, is now becoming the main plug then there is a challenge. At least we can boast in Lagos State, in all our PhD, in all our local government. There's no local government you go to in a PhD that you will not find at least a medical doctor there. Not to talk of the nurses that is adequately provided for, and the services, the equipment are there as much as possible. However, there is always room for improvement. They said the largest room in the world is the room for improvement. You can never say you have enough. So, because I still remembered, there was a CSR that was done in one of the facilities recently, because even when power is supplied, you do not have that uninterrupted as much as you would have loved for healthcare facilities. What can you do without lights? What can you do without power in the hospital? So recently I saw something where somebody did a CSR to one of the health facilities to provide solar, so that when the NEPA is not working, the generator has gone off, there's no diesel, or it needs to rest a bit, then the solar continues the uninterrupted. So this is where we have the public-private partnership. Government cannot do it all. So we still need the help and the support of those well-meaning individuals, corporate organizations. Remember what happened during COVID? We couldn't tackle it alone. Government couldn't do it alone. Everybody came and put hands together, and by the special grace of God, we were able to solve and overcome that in a bit. So it is not on government alone. They are trying as much as possible. And another thing is monitoring of these resources. It is one thing to allocate, is another thing to monitor and ensure it trickles down and gets to exactly where it's meant to. We know we've heard a lot of situations where the proper allocation is done, but it does not really get to the end user. So we need the things to be put in place, measures to be put in place to be sure that this that we have allocated for this healthcare service has really gotten to the end users. There's really a lot to be done, even in that aspect. So allocating enough is not just okay. Making sure that that enough gets to the right places where it's meant to is another aspect that needs to be looked into critically. I hope I'm still with you and you can hear me.
Yes, I can hear you, or we can hear you. And it's amazing how you have highlighted how, if you really look at this thing, it's a human thing. The allocation is coming from a human. The getting to the end user, it's a human. That middleman transaction is still dependent on, human roles. But we still have issues where even training is a problem. We have issues where capacity building is a problem. So how can we, or what role do you think that, training and capacity building programs can play in improving these issues like maternal and newborn health outcomes, especially when we have emergency cases where it's almost, sometimes even when they have given birth to the baby at home, they are dragging the umbilical cord and the baby to the hospital, they are bleeding. Some, they don't even know that they are in labor, and all these emergencies can get everybody worked up. So I feel like sometimes you might go to some hospitals and they don't have adequate training of how to handle those issues. Sometimes they don't even have the idea or the capacity to even take care of those issues, especially in the primary health centers. I don't want to talk about the big hospitals now. I want to talk about like the first response, which is the primary health centers.
First level of care. Yeah, okay. So training, like I said, I can talk about the system where I work in more. So training is being done from time to time, and there is always room for retraining. You don't just graduate and we leave you there after employment. That's all what they trained you while you were in school is just sufficient to carry you on. You first of all have an orientation. Then there's something we call mandatory continuous medical programs for doctors, for nurses, and other level of healthcare. Do you know that for Medical and Dental Council of Nigeria, I cannot renew my annual practicing license if I've not done a basic minimum of 20 CME units of retraining during the course of the year? That's one of the requirements. And I know it's the same for nurses and the other cadres. And this is always submitted. For government institutions, you need to submit a copy of your practicing license that has been renewed each year to admin. And we have something again, Health Facilities Monitoring and Accreditation Agency, an agency in Lagos State that monitors both public and private facilities. So this goes beyond, like I'm in the public system, I can speak for the public system, but like we know, so many quack systems are springing up in the private sector. So to put in check and eliminate those ones that are not well, that do not have the well-qualified manpower, we have this agency that goes from time to time, and they won't even accredit you. They usually have that sign. I don't know if you've ever observed one before, that this is a HEFAMA accredited facility. So this is one of the things to watch out for. Again, while you're going into a facility, is this facility accredited? I know you might want to look at affordability, accessibility. How about safety? How about you go in there and come out safe? It's not just this is the closest place I can get. Do they have the kind of manpower that will be able to handle this emergency that I'm talking about? Because in as much as you're talking about PHCs now, about training, I can assure you that as long as it's a government system, we have capacity building that is done for health workers from time to time. We have the Department of Family Health in the Ministry of Health, and they are responsible for these trainings from time to time on family planning, on nutrition, on maternal and newborn care. And it trickles down. It's not only for the tertiary institution. They train people in the secondary health facilities. They train the PHCs. However, to put in check what happens in the private hospitals, we have that agency that goes to check from time to time on monitoring to ensure that the facilities that we have in the state are safe. And when people go there, because it's one thing for us to even tell them to get to the healthcare facility and look for trained personnel to take care of them. When they get to the facility, I wish other facility they are going to is safe and can give the adequate care that they require. That's why we have this kind of agencies and things put in place by the government to address this.
So it's great to know.
I
I
hope
think
I've
that
been able
a
to
lot
talk
of
about the training of the personnel.
yes, ma. I think that one thing that I can maybe argue to a fault that a lot of Nigerians don't know that our nurses and our doctors are properly trained, especially in for government-owned hospitals. There's the notion that the government hospitals are very terrible, and that's why a lot of people try to run from private hospitals to hospitals that they don't even know if the doctor is licensed or not. But just because he sits on a nice-looking chair, it's assumed that this person has more, knowledge than the rest. So I hope that Nigerians can know now that our doctors and our nurses are properly trained in both capacity building and response. I will let Oluchi take a question for you.
All right, Doctor, thank you so much for your insightful contribution. I like how we've mentioned different varying factors from training to resources, and I'd like us to go back to financial resources again, because there was a recent story that was trending on social media, how that a man lost his wife and child because the hospital they had gone to, they couldn't make a deposit, for them to proceed to even attend to her. And then the man even made a video in the car and it went viral. He was pleading that the woman should stay with her. But by the time they went to the next healthcare facility, she had already gone. So I'm here thinking that it seems as though the healthcare system punishes women who are poor. Because it's almost like if you do not have this kind of resources, nobody is going to attend to you. I know that that's a very controversial one, and doctors have different points and angles to which they address things like this, but it's already becoming a major issue. Childbirth, giving birth to children is a lot of money, and people who do not have this money, sometimes they have to use public facilities which don't even have the resources. So what's being done exactly to ensure that there's a balance and people don't die because of money? I don't know if you get my question.
Yeah, I do. And I'm very happy that you are mentioning this particular case that is under investigation, that the Honorable Commissioner for Health has come out to even bring out a message concerning that. Like you said, people have different opinions on this, but there's a fundamental question I asked, and I had mentioned this earlier. A woman is pregnant, not for a day, not for a week, not for a month, 9 months. I want to ask a question. This facility where it is still under investigation. The facility they said they went to, is it possible that that facility was where she was receiving antenatal care? I'm seriously doubting that, because if it is a facility where they've been receiving care, they would have known them very well, not only the medical history, but also the financial history. And there's something they say in the Yoruba adage that the eye that has known you cannot see you and say, I do not know you again. So you cannot manage a pregnancy for that long, and it's time for delivery, for everybody to clap for you and say you have monitored and the mother is safe, and you will reject that person. That is on one side. There is what we call health insurance. We have it at the national level, National Health Insurance Act, which is mandatory for everyone, whether in the formal or informal sector, to contribute a little before it gets to the time that you will need healthcare services. So you can confidently walk into any health institution of your choice that you have already chosen ahead, and you will be given healthcare services. Was this method explored? In my own facility, aside the health insurance, we even advise and suggest to women that they can pay a bit in installments ahead of the delivery date, so that it doesn't just come to you like a bang. For instance, for normal delivery, the charge could be like 50,000 naira if everything is okay, and you started and sending antenatal when you were like 3 months pregnant. Pay 10,000, pay 5,000 when you have, so that by the time is the delivery time, you have already settled your bill upfront. There are a lot of things we can do on our own. It's not all times about shifting the blame and all that. Yes, there is an act in the Health Act. There's an aspect that talks about emergency services to be rendered in the very first 24 hours without asking for anything. So that's another aspect that we have to look at, but people still ask that question: who cares for private facilities? Because in the government health institution, yes, I offer the facilities, I offer the services first 24 hours. I go back and I do a proper report, and I know how to reconcile my accounts. But for the private facility, do not forget that healthcare is a business for them. Who takes care? Have we been able to cover that gap, that aspect of when they take care in the first 24 hours? Who settles them? Who reconciles for them? But that said, like my honorable commissioner said, it's very pathetic, it's very painful to lose a woman because of doing the natural thing that God created her to do. But then there is the aspect of being proactive. I had a lot of problems with that video. I wasn't expecting that instead of putting a car in gear 5, we're recording. Nigerians and social media and all this, God will help us. But then there is something on the part of the healthcare system, but there's something again on the part of an individual when it comes to being proactive in healthcare. It is my health I'm talking about here. Can I do a little more for myself instead of waiting? So you've talked about the low socioeconomic. The low socioeconomic person, is it so bad that you cannot enroll in the health insurance scheme? Is it so bad that you cannot go to a government facility and pay bit by bit before this your 9-month visitor arrives? So it leaves a lot of questions that are supposed to be answered, really, on both sides.
You've mentioned
shifting.
All right, Ma, you've mentioned this national health insurance scheme a number of times, and I just want us to have a bit of clarity. Does it adequately support child birth and maternity care, or is just scratching the surface? Because the fact that you mentioned it over time, I want to know that it adequately supports childbirth and maternal care.
It does support. I can tell you of the Lagos State Health Insurance for free. If I'm a member of the Rotary, there was a time my Rotary Club supported pregnant women to enroll in the Lagos Healthcare Scheme. And I can proudly tell you that even those that required cesarean section, they were done for free because they were under the health insurance scheme. So I can tell you that it adequately takes care of it.
Okay, as I said, you are sort of helping us and even our viewers know the facts about Nigeria healthcare system and the things that we should do moving forward. Well, I want us to quickly talk about family planning. I saw a video yesterday where this woman had 7 children that were special needs. And then when she got interviewed, she was talking about how the baby was fine from the stomach. And then when she gave birth, everything was still all right. 2-3 months as the child was growing, that's when she started seeing that it was not, the child wasn't growing up well. And she eventually had 7 of those special needs children. At some point, she even had twins. And her husband is nowhere to be found to start with. But how do we now? It's almost like she said she went to the hospital, everything was fine in the stomach, but all the time that she came, nothing happened. We also asked about family planning, and she said all the family planning injections or insertions that she did failed, and that's why we have the case of 7 special needs kids. So how can we talk about, is there a way we can address the potency of family planning and how accessible it is for women who want to do these things?
That woman must be a very special woman for all the family planning methods to have failed. I know that there is hardly any family planning method that is 100%, but I can also assure you that there is none that is less than 90%. So it's intriguing to hear that. And for her to have said that during the pregnancy, maybe she did scan and they said everything was okay. It's just after delivery. In my mind, I'm wondering, maybe one of those things, periods, those issues we have with the newborn is either asphyxia, the lack of adequate oxygen during the delivery and the early period, or maybe jaundice. Those are the kind of things that if they are not treated or addressed immediately at the newborn period, you think everything is okay until when the developmental milestones start. When you expect neck control at 3 months and the neck is still very floppy, you expect that the child is sitting at 6 months and the child still cannot even have neck control. You expect the child to be walking 2 years, you're still having to assist a child to walk. That's when they will now trace back with adequate history. You now know that it was a problem with the neonatal period. So apart from having neonatal mortality, we have all those challenges again that go with people for a whole lifetime. And that is why this perinatal period, the time between giving birth and the very early part of the first 24 days, the first month, if I may use that, is very critical and needs to be addressed very properly. Then back to the family planning. So the family planning, we have the commodities. Yes, we need to improve accessibility and availability of the commodities. Then are people well informed? The last survey they did, I learned 52% of our, is it up to 52% that are even, no, it's not, it's the antenatal that is 52% of people attending antenatal clinic adequately. Family planning is way below that. It's very low. I'm not even sure we have up to 20% coverage. So what is the challenge? We try to mitigate the challenges of lack of awareness by increasing awareness, but we need to move into the community more. Because what we try to do, especially in the clinics, is when you have delivered and you bring your child for immunization, we counsel you on the need for family planning. When you have delivered and you come for your postnatal clinic check after you have delivered, we counsel you on the need for family planning. But you know, it is one thing to counsel, is another thing for them to take the advice. And like I said too, we need to move into the community, because the truth is the people that we see in our health facilities are what they describe as the tip of the iceberg. We still have many more there that we need to reach out to with the adequate information that this actually saves your life. You want to be proactive in preventing unplanned pregnancy instead of you to go and get pregnant by mistake and get into the wrong hands trying to remove it. Septic abortions and all the other complications, maybe infertility for those ones that have even not had adequate number of children that they need. It's a very vital thing that we need to look at. So the family planning, improving access is very important, improving availability of the commodities, the different ones. We have the oral ones, we have the injectable ones, we have the insertions, we have the implants that they implant into the arm, and we have the coil that the IUCD we call intrauterine contraceptive device that can last for almost 5 years or more. So we have different options that women can take. Different ones have their level of effectiveness and adaptability, because you need to look at the individual and their histories. There are some that if you have high blood pressure, you may not be able to go on and all that. For people that have irregular menstrual bleeding and all that, there are some that may not be applicable. But of course, with proper information and counseling, the healthcare worker will be able to narrow down on the best that is for that individual and be able to apply it adequately.
Thank you, Ma.
So that's the intro on family planning.
Thank you, Ma. I would have loved for my co-anchors to still ask you more questions, but because we need to wrap up, I just want to hear your recommendation. And in that, I want you to talk maybe in 1 minute about how we can address malnutrition and, general maternal and newborn health outcomes in Nigeria.
Okay, so for the nutrition, most of it elementary feeding for the children, but then we try to teach them when they come to the clinic that it doesn't have to be NAN, it doesn't have to be SMA Gold, that you can also use what we have locally. So they teach them how to use crayfish and pap and all those fortified and used to give the children. So that is on the passing notes for nutrition. It still boils down to information, adequate information, that it doesn't have to be this milk thing. If you can't afford it, we have locally available things that you can give to your babies and they will be as plumpy and healthy as you want them to be. Remember, the World Health Day was a few days ago, is marked annually on the 7th of April. And the theme for this year is healthy beginnings and hopeful futures. And this wraps up all what we've been trying to say, talking about maternal and newborn health. So for us to be able to have this adequately tackled, we need to be proactive as individuals, as the pregnant woman, and as government and as other corporate organizations working hand in hand to support government to be able to deliver the kind of healthcare services that we need, so that we'll be able to have our hopeful futures. Because at a point, we know we can't be here forever. It is these newborns that are going to take over from us. So how best we bring them up into the world, make sure that we do not lose them at the point of delivery, and they are born healthily to be able to